Hi, I am Hillary Davis, and I am a licensed marriage and family therapist and licensed clinical practitioner and counselor with Touchstone Therapy Center. We are formerly known as Therapediatrics. Some of you in the community may be familiar with us. We have changed our name as we have grown and expanded over the years, and we are no longer just seeing pediatrics, but we see adults as well. We do individual therapy, couples therapy, family therapy, parent coaching. We do support groups, we do skill groups, we do presentations, we have therapy book clubs for parents. So we do a little bit of everything. And because of that, we thought that the name Therapediatrics was not encompassing all that we were. And that is why we are now known as Touchstone Therapy Center. So I want to thank you all for joining us today. Megan is going to be managing the chat. So if you have any questions, please feel free to put those in the chat, and then she will be saving those for the Q&A portion of our presentation. And today what we're going to do is a general overview of destigmatizing mental health with children. And again, it's a general overview, so we're not going to go in depth into everything. So if you have more questions, again, please let us know in the chat, because we will try and get you more information. There will be handouts. Megan will also be adding those into the link within the chat as well. They will also be attached to the presentation when it is sent out tomorrow as a recording, so that you have those as well. But just in case you're wondering what I'm referring to when I bring up certain things, you can find that link in the chat today. In addition, if you feel like I am going too fast, you're not keeping up with some of the information, there will be a replay, and you can always go back to that as well. So for today's Lunch and Learn, we are going to be talking about understanding mental health, specific issues affecting youth today, recognizing warning signs, and talking to your children. And this is important when we think about destigmatizing mental health, because destigmatizing mental health for youth is important because it reduces the suffering and silence that kids can feel on a day-to-day basis. When they don't feel that they have safe spaces that they can talk to either adults or other family members, school staff, social workers, it can feel very isolating, and they can feel ashamed of any mental health challenges that they're having. So when we understand a little bit more about mental health, when we destigmatize it, what we can do is we can target early interventions, promote resilience with children, prevent more harmful coping mechanisms as they get older, like self-harm and substance abuse issues that might be more prevalent as they move into their teen years. And it helps kids build a more supportive community. So we're looking at it and we go, okay, well, what is mental health? And mental health in childhood means reaching developmental and emotional milestones and learning healthy coping skills and how to cope when there are problems. And when we're looking at that, a common question that I get is, well, how do we know what's age appropriate and what's not age appropriate? Again, in the chat, Megan will have the handouts for you, but one of the things that we have for you is behavioral challenges by age, and that goes through developmentally what kids should be meeting from a social and emotional point from infancy up to adolescence. Also, we have in there a handout that goes through age-appropriate behavior versus several different things like mood disorders, anxiety, attention and focus, and social issues. And so when you look at both of those handouts, it'll give you a better version, a more in-depth version of what might be considered age appropriate. That said, that leads us to challenging myths and misconceptions when we talk about mental health. And one of the most significant misconceptions is that children are immune to mental health problems. So that is not the case. And in fact, a lot of adults tend to dismiss issues that kids might be having as just a phase. And when we do that, it kind of dismisses for the children any of the fears, anxieties, insecurities that they might have. So you never want to kind of just dismiss it as a phase, but kind of start looking at it as what is a warning sign and what might be age appropriate. So we gave you some information about age appropriate information, but just to also help you out with noting like what is age appropriate and what might be an early warning sign. I can tell you what we do at the clinic as therapists is we're looking for frequency, intensity, and duration. And what I mean by that is we're looking at how often does it happen? That's your frequency. If we looked at a scale of 0 to 10, 10 being the most intense, 0 being not intense at all, where are we falling on the scale here in terms of intensity? Duration, how long are things lasting? These things help us to figure out, is this just a phase or is it something else? And again, they're warning signs. So, they're worth checking out, but it also doesn't mean that we have to go into, getting over anxious about things. So, for example, frequency. Everyone has bad moods. They can last a day or two. Even as adults, we wake up on the wrong side of the bed and we're like, hey, it's a bad mood. But one day is not 10 days, is not several weeks. And those are the things that you want to start watching for to go, how long is this lasting? Is it, if you have a younger kid that might be in elementary school and they're having an a hard time with emotional regulation? Is it something that is taking 15, 30 minutes and then you can redirect them? Or does this go on for hours? How intense is it? Is it that we're just saying that we're in a bad mood? Or are we saying things like, I just want to die? That helps us understand how big the problem is. And so you're going to hear me bring this up again in several different areas. So you want to keep again in your mind this whole duration, intensity, and frequency as an important determination to kind of figure out what's really a problem, what might not be a problem. So with that, there are issues that are affecting today's youth. And we want to look at those as well. And actually, let me back up just a minute because I didn't address what's happening in the brains as people are coping with mental health. And so when we think about brain development, a lot of that development happens between the ages of 3 to 5, with most of the brain structure being there by age 9. And the visualization that I like to use with people with that is imagine that you're building the house, but your brain is the house. When you're 3 to 5 years old, all these things are happening, and that's causing a lot of dysregulation. And that's what we're talking about with the terrible 2s, the terrible 3s, the terrible 4s, because they're all over the place because their brain is growing so much. And then, what ends up happening is those early years, which are crucial for brain development, happens again during adolescence, and it's a remodeling period, literally. So the brain is literally remodeling itself. But again, if we go with this house metaphor, now we're remodeling the house. So if you ever stop to look at it, a lot of the teenage behavior that's all over the place mirrors some of the stuff that we see in toddlerhood because they're going through something similar. That remodeling can go into the mid to late 20s for adolescents and young adults. And here's something that I think is really interesting, and it's something important for parents to know, is that the brain development starts from the back of your head and goes to the front of your head. And why that's important, it was because the very last piece of the brain to develop is the prefrontal cortex. And that's the last piece to mature. And it's important because that is the piece that is responsible for planning, prioritizing, and making good decisions. And to kind of put that in like real life terms, what that means is, as parents, sometimes when you've got an adolescent, you're going, okay, you're acting really mature here in one moment. And then in the next moment, you're incredibly emotional and impulsive. And how can you be incredibly emotional and impulsive and also show this maturity? And sometimes we might get angry at our kids going, you should know better because you can do this thing over here. But really what that is it's more symptomatic of that brain development because that is what's happening. There are pieces that are maturing and there are pieces that aren't maturing as fast. And that's important because that also helps us understand why kids put social process as a bigger importance, where they can go, okay, they're willing to take more risks because the social benefits outweigh the consequences. Teens also respond differently to stress and anxiety during this time than adolescents. So it can increase anxiety and depression if you aren't aware of some of what's going on. And there's some books out there, there's some great podcasts if you want to know a little bit more about how the brain develops from childhood to adolescence. But recognizing this as a possible trigger also helps us to develop effective coping skills that can help kids focus better with stress and mental health. So again, in addition to moving from childhood to adolescence and the changes in the brain, also they're being affected by anxiety and depression, suicidal ideation and self-harm, aggression, bullying, and cyberbullying, stress and academic pressure, gender issues, and access to treatment. And we want to be considerate of all of these things because it really is a struggle. Adults have their own problems, but children and adolescents have their issues as well. So, what are the warning signs when we're trying to figure out, is there something going on, that we really need to pay more attention to? And that includes changes in behavior and emotions, changes in sleep, eating, or physical behaviors, social isolation or lack of interest, decline in academic performance, and difficulties coping with stress. Now, you may say, Hillary, all these things happen all the time, and they do. We all have that, whether we're adults, whether we're children, we have these warning signs that happen on a day-to-day basis. But again, that's where we're going to go back to that frequency, that intensity, that duration piece. So for example, everyone can have a bad night of sleep, but one bad night of sleep is not the same as changes in sleep over a period of a week or 2 or 3 weeks. You can have a decline in academic performance. You could be sick. You could be out of school and catching up is hard, or you're feeling really stressed out. But that's different than seeing a decline in academic performance over a certain amount of time, or how bad that decline ends up happening. So using that measurement of frequency, intensity, and duration can really help in terms of determining what is age appropriate and what might be something that you want to pay more attention to. So what do you do with that when you think that there is something going on and you want to find out more with your child? That leads us to promoting open conversations. And when we talk about promoting open conversations, that is a huge part of destigmatizing mental health, because when we can talk with children and teens about sensitive topics, what we can do is create an environment where they feel supportive and they feel that it's non-judgmental, and that can make a significant difference in their lives. Building trust and maintaining an open line of communication with children and teens is an ongoing process, but the more consistently that you can do that, the more you can create a safe space for them to share, and they're more likely to be comfortable discussing important topics with you in the future. So I want to go over a few points in terms of what makes a good open conversation. And you'll also find this in a really great handout that we have. Again, Megan's going to put the link up in the chat so that you have all of those handouts available to you. The first thing is choosing the right time and place. Timing matters. You want to choose a time where your child is feeling relaxed and more likely to be receptive. So it's interesting because I don't know about you or if you've heard this before, but you can kind of give a raise of hands. Kids talk more when they're in the car, and it makes sense because when you're in a car, you're facing forward. You don't have that pressure of someone looking at you. At some point the conversation is going to end because everyone is going to get out of the car. And that can be something that can make kids feel safe to open up a little bit more. In addition, you may have noticed that kids tend to open up at 9, 10 o'clock at night, and you're going, why now? And it's because they're relaxed. It's the end of the day. They're unwinding. They're in their safe space of their room. So you want to think about some of these places and times where they are more receptive to having a conversation rather than right when you walk in the door and it's the first time you're seeing them and you're like, how was your day? You want to practice being a good listener. So you want to both let your child know that you hear what they're saying and you want to validate that. And what I mean by validate is a lot of times I'll get feedback from parents and they'll be like, well, but if I validate them, am I agreeing with them? And you're not. You're being empathetic. You're putting yourself in their shoes and taking their perspective. So, for example, let's say you've got a kid who missed a week of school and they are now all over the place and they're going, I'm never going to catch up. This is going to be horrible. I'm so anxious. I'm going to get, a bad grade. This is going to affect my grades. I'm never going to be able to catch up. My teacher won't understand if I ask for more time. Your instinct as a parent is to want to problem solve and to try and help them with that. But really, that first piece that you need to work on is validating that feeling and going, wow, you know what? I get it. You missed several days of school and now you're feeling overwhelmed and you're scared. And it feels like this is going to be too big to accomplish. Letting them know you hear them is going to go a lot better than moving into that problem solving right away because they will feel like they are heard, that they are seen. You want to use open-ended questions. So how many of you have ever asked your kid at the end of the day and you've said, how was your day? And you got like it's fine, it's okay, just a short 1 or 2 word answer, right? So if we're looking at this, it is a closed question. It does not invite conversation. Whereas if we're asking open-ended questions like, hey, tell me what the most challenging part of today was, or what was the best part of your day today? Those are questions that are going to elicit more information from your child than how was your day? And we want to think about those things like, how have you been feeling lately? Are you feeling okay? Those things will stimulate more conversation. We want to avoid judgment and criticism. Your goal is to create a safe space where children feel comfortable sharing and sometimes even maybe share our own experiences. So, you want to be careful not to overshadow their own feelings or experiences, but sometimes you can use your own stories of having dealt with certain things that might be similar as a way to connect with your child as well. So we also want to respect their privacy. If they're sharing something with us and you push too hard, they're going to close down. Obviously, we want to be concerned with safety always. So if it's a safety situation, these go out the door. But if it is not a safety situation, you want to respect their boundaries as much as possible and avoid prying or pressuring them to reveal more than what they're ready for. Again, this will come back to you in the long run in terms of them trusting you again when they talk about things. You want to, normalize their feelings, letting them know, it is okay to seek help when needed or to talk about it. And offer your support and understanding. And then the biggest thing of all is you want to avoid a lecture. That is stuff that we see in the media, in books, and everywhere. Parents lecture. A phrase that we like to use here is connect before you correct. It's natural to want to problem solve and give advice. But if we can focus on connecting first before giving advice, you're going to have more of a back and forth conversation where kids feel like there's something that they contribute. So something to kind of keep in the back of your mind as well. And we're going to talk about promoting open conversations a lot because this is how we talk about things that are issues. And 2 things that out of the list of things that are affecting youth today that I really want to focus on today are the impact of social media and anxiety. And we're going to stick with these 2 primarily because of our time limits here today. But of course, there's so many other things that are affecting youth. And if you have anything that you want to know more about, again, please put that in the chat and we will do our best to answer that as well. But we're going to talk about, in particular, the impact of social media and how you can promote open conversations with that. So, it's an interesting thing, social media. And it's kind of like a double-edged sword. There's a lot of research out there that shows that it's become a new way for kids to connect, to build community, to develop friendships, and that's great. And in fact, it was a huge part of keeping everyone connected during COVID. However, on the other hand, there's also research that says that it has a negative effect on kids as well. So there was a study in the Journal of Pediatrics that found that kids that habitually check their social media accounts actually had actual changes in their brain in the centers that control social rewards and punishment. And that's concerning. There was another study on kids ages 12 to 15 that showed that kids who spent 3 hours or more on social media actually doubled their risk of experiencing poor mental health outcomes. So these are things of concern, and there's a whole host of information that's out there, and I'd encourage you to find out a little bit more. But in addition to that, there's, comparison and body image issues, cyberbullying, fear of missing out, the lack of face-to-face interaction, seeking validation, social pressures, increased anxiety and depression, exposure to negativity, time management, and decreased sleep. And again, this is a whole nother session on its own. And we do have a presentation that talks about digital safety and healthy social media. But for today's purpose, I want to use this as we're kind of talking about destigmatizing mental health to talk about how you can have an open conversation, because from the standpoint of, a lot of parents are like, get off your devices. And kids are like, but this is how I connect with my friends and all of that kind of stuff. How you have a conversation about it can be just as important as what you're having the conversation about. So let's take fear of missing out, or FOMO. A lot of kids walk around, they talk about FOMO, but if we're talking about mental health, what we really want kids to know about is, what are the emotions that are with that? A lot of kids don't have a very developed emotional vocabulary. And so if someone's like, I'm really having FOMO right now, and they're sad and they're depressed, we want to go, okay, well, what is FOMO about? It's about being disappointed. It's about feeling hurt. It's about feeling isolated. It's about being frustrated. And that can happen whether you're 6 years old and you weren't invited to a birthday party, or it could be when you're 16 and you're seeing on social media people going out pumpkin picking and you weren't included. All of these things can contribute to this idea of FOMO, but really what it's about and what we want to teach kids is it's about handling disappointment. And what do you do with that? And that's a whole different conversation than just saying, well, I got FOMO. So, as an example, that is certainly something that you can use an open conversation for that would be helpful. That said, as parents, you can also help your children by having conversations and modeling healthy social media behaviors. I know it's hard to hear, but if parents are on their phones all the time, kids see that, they're going to model that as well. And we can take that modeling a little bit further and go, when we promote healthy conversations about mental health topics, when we bring it up and not in reaction to something, but because we just want to have those conversations, we model to our children the way to handle situations. You want to set limits, but you want your kids to be involved in those limits. So maybe you have them research some of the stuff that we're talking about today and have them be part of making those limits. It's going to go a lot differently if they feel like they have a part in this. You want to talk about healthy social media use and certainly monitor it. You also want to encourage offline relaxation and social media breaks. And to go a step further with that, you want to be able to, with your kids, then talk about, what did that feel like to take a social media break? Did you get jittery? Was it hard? Was it something that you eventually relaxed into? But that starts that conversation so that they can see for themselves some of the things that we're talking about right now. In addition to social media, again, I wanted to talk about anxiety, because anxiety is a huge part right now and is on the rise with both children and adolescents. And, we can take this and kind of incorporate as parents, what are some things you can do? Again, we can go incredibly in depth into this area, and I'm briefly going to touch on this. But a lot of our therapists here at the clinic have been trained by the Yale Child Studies Center that created the SPACE program, which is supportive parenting for anxious childhood emotions. And really, this was developed on research that they had done around anxiety and finding that there's a piece that needs to happen that's the parent intervention. And that has nothing to do with the kids. And so there's a 12-week program that they have that is set up that we've learned and incorporated that kind of is about how parents can support their anxious children to help them gain the confidence to be able to utilize some of those coping skills that they may learn. And again, I don't know if you guys have ever had this, but like, kids might go to therapy and they learn skills, but then they're like, but they're not utilizing those skills. And that's what this program is all about. Because children who suffer with anxiety tend to rely on their parents to avoid anxiety. And then what happens is because they're so anxious, you want to go in, you want to help them, you want to protect them. And doing that can actually establish a pattern that actually maintains those anxiety behaviors. So often as parents, we're pulled in two different directions, and it's kind of polarized. You're in this place where you want to reassure your kids, you want to protect them, but it's sometimes you also end up feeling like, they've got to learn how to handle some of this stuff on their own, and you want them to be independent. And then this becomes a challenge because the kids are getting mixed messages. You're going to come and save me. And also there are going to be times where you're going to be like, figure it out. And that can be really difficult for children to manage. So that's one of the things that we wanted to kind of talk about is how do you create some supportive statements that help kids with anxiety? Again, having some of these open conversations about mental health. So we'll get to how to craft a supportive statement in a moment, but I also wanted to touch on protective statements, demanding statements, and accommodations. And just as an aside, demanding statements actually isn't as negative as it seems, but we'll kind of go through that in a second. So protective statements are, my job is to protect my child. I want them to be safe. Protective statements are, my job is to promote independence with my child. And accommodations are the behaviors we as parents or adults make to help our child avoid what is making them feel bad. So an example of this might be, let's say your kid forgets their phone at home and they call you up from school and they're like, you need to bring me my phone because I'm not going to be able to get through the day without it. And it's going to be too hard and I'm going to be anxious and I'm not going to be able to concentrate. And, sometimes parents have that instinctual piece to be like, I'm going to run that phone right over, because if that's going to keep you from like being not attentive all day or having trouble with focusing or having a panic attack, we'll get you that phone. Some parents will be like, you got to figure this out on your own. But when we make those behaviors where we kind of help them by going, okay, we're being helpful by bringing that in, again, what it's really doing is creating a pattern where that anxiety is being maintained instead of feeling like the kids have their own healthy coping skills to be able to manage that. Now, that said, there are times where there are dangerous things that are happening, and that if we do something because there's a dangerous situation, we are not accommodating our kids. That is a healthy protection. So I just also want to make that very clear that safety matters. So on this next slide, you're going to see that we have some examples of protective statements, demanding statements, and supportive statements. And I'm going to go through just like a couple so that you kind of get the idea of how they differ from each other. So a protective statement, and again, remember, this is all about, I want my child to be safe, is they can't handle the stress. And then there might be an accommodation that goes with that. The demanding statement, which, as you might recall, is about, I want my child to be independent, is you should learn to get over the stress. And a supportive statement in this instance might be, it's hard for them, but they can learn how to manage it. Or I know you're facing a challenge right now, but I know you have the ability to do this. And that's important because, again, what we're trying to do when it comes to mental health is we're not trying to go on that seesaw of protection versus independence, but we're trying to help them realize that they have the confidence to be able to utilize the skills that you as parents or the social workers or counselors at school or teachers are teaching them. So To do that, it's a real simple equation. You want to have acceptance and validation plus confidence equals a supportive statement. So when people respond by acknowledging the fear, the anxiety, you're legitimizing what those fears are. You're not dismissing it. And the big piece here is the and part, not the but part, but an and is when you combine that with a statement about confidence, that helps your kids, and this is research based, to withstand slightly more anxiety than maybe they did before. And over time, that will build up. So, as you're talking, you're keeping these open conversations happening. We're talking about mental health. These are things that you absolutely want to talk about with your kids, and supportive statements are the things you want to include in those conversations as well. So, that brings us to self-care for children and parents, which is essential for mental health. And I'm going to talk about this more from the parents' angle, because again, if we go back to this concept of we model what we want to see in our children, this is important because when they see you doing this, they are more likely to do this as well. But you want to set healthy boundaries. So you want to set boundaries and routines in your family to manage stress, and you want to make space for self-care. And when you do that for yourself and you label that and you're like, hey, I need to take some time out in my room because I need to settle down. I need to read a book. I need to center myself, and then I will come back in. We model that for our kids. It doesn't become a punishment then to go to your room. It might be, hey, I need this time to take care of myself. You want to explain why you're setting those boundaries and why it's important. And it also helps kids to respect other people's boundaries. If they see it in their house, they're more likely to do it outside their self. You want to practice self-compassion. I've heard this a lot. I don't know about you guys, but has anyone ever had like a time where they felt like a bad parent? You know? Yeah. And we get this all the time in the clinic. You want to be compassionate and kind to yourself. People make mistakes. And in fact, it can be really great to see a kid or have a kid see their parent lose it and then make that repair afterwards, because that models for them, one, mistakes are okay and people lose it. They don't have to be perfect all the time. But when that does happen, what do we do? What's the healthy version of being able to deal with that? So if you lose your temper, you are not the worst person in the world, but what you do after is incredibly important. If your kids see you come to them and you say, hey, it was a really rough day at work, and that is not your fault, and that was up to me to manage that differently, and I apologize for that. That's going to go a lot more towards kids recognizing that people have a hard time sometimes, and what we do might not be okay, but we can repair and make amends. And sometimes you want to go, if I would tell a friend this about what happened, why can't I tell myself this about what would happen? So just remember to give yourself a little bit of space and a little bit of compassion, and also seek support when you need it. Rely on your network of friends, families. Um, if you need to, professionals, there are plenty of resources that are out there. We're going to share some in a moment. But don't feel isolated in this, because that just perpetuates more mental health issues. So understanding mental health is just the first step. And the next steps are ensuring that your child feels a sense of belonging, that their voice matters, and that they find the right resources to support themselves and for you to support yourself. Going forward, I just wanted to let you know we are going to have 2 more lunch and learns, and that we would love to have everybody join us. So we are going to be doing fostering and accountability and responsibility with your children in January. And in April, we'll be doing a lunch and learn on appreciating diversity and raising an inclusive child. Now, that said, if you liked the presentation today, please let us know, because then we will work on doing more of the same. If there are things that you would change about it, again, you can put that in the chat as well. We love feedback so that we can tailor these things going forward. And also, this presentation is going to be recorded. So if you like it, share it. The more we can get this information out into the community, the more people that it will help. And also, there's some really great topics that are coming up here. There's other presentations that District 73 does with other agencies and practices that are really valuable. And those resources are there for parents. And we want to get it into their hands, because the more the parents feel supported, the more that they can support their children. So if you also have other topics that you're interested in, please let Megan know by dropping that in the chat. And check us out at touchstonetherapycenter.com to view a lot of the things that we do. We see kids from 4 all the way on up to adults. We do individual counseling. We do family counseling. We do couples counseling. We do parent coaching. We do presentations. We have a parenting book club. We have social skills. We have support groups for parents. And also, if you look at the QR code at the bottom of this slide, we have something called the Flourishing Families Network, which is a Facebook group that we regularly post tips. We have videos. We might post handouts for parents. You do not have to be a client of ours to participate in a lot of these extra activities or in the Flourishing Families Network, because again, we believe that when we support families, we help families grow. And so we want to make sure that parents have access to some of this information as well. And if you like this, we'd love to connect more with you. Let us know how we did. Also, you'll find, some resources here. It is not all the resources that are up there, but these are some of our favorites at the clinic that we recommend to parents. There's books, there's podcasts, there's other resources. In the other resources, I also want to add that there's a really great organization called No Shame on You that provides a lot of good information. They have like an ebook that kind of talks about when to know if they're mental health issues that are kind of getting out of control and what can you do about them. And I believe if you just look up No Shame on You on their website, you'll be able to access all of that information. And if you need more information, again, you can either go to Megan or you can come to us as well at Touchstone Therapy Center, and we are happy to get you more information as well. So I want to thank you all for listening today and taking time out on your lunch. I hope that this was helpful to be able to kind of fit this in your day, and we'd love some feedback from you. So, feel free to reach out to us, and have a great day. Thank you.